So let me start by introducing this great opening collaborative panel from San Diego. This is the Mid-City CAN Community Advocacy Network, but it's also part of the California Endowment Building Healthy Communities program. So first we have Diana Ross, all the way to my right, who's the collaborative director for Mid-City CAN. And then next to her is Ramla Saeed, who's a community organizer and now on staff of Mid-City CAN, but actually started as one of the leaders of their working groups or momentum teams, and then came on staff, and she'll talk about that story. And next to Ramla is Fernanda de Campos, who is the Farmers Market Coordinator for the International Rescue Committee, which is a refugee resettlement organization in San Diego. And then finally, to my near right is Ido Gele, who is the youth community organizer for a local organization, Youth Empowerment Focus. So let me start with Diana and ask you to just give us an orientation of how Mid-City CAN came about and the work that it was trying to accomplish in the neighborhood.
We are a collaborative that is about 22 years old. We started in the late 1980s, and at that time it started in a really interesting way. We work in the neighborhood of City Heights in San Diego, and City Heights had started to experience a dramatic change. Business had left, the economy was down, violence and crime were up, and a resident by the name of John Hartley, who at the time was on the city council as well, came to City Heights and said, hey, City Heights, we really have to start to come together and make some changes because what's happening is not okay. And it had really gotten to the point where the local business association was, instead of spending their money on business improvement, was spending their money putting up billboards that said, stay out of City Heights. So this really inspired John to start to bring the community together. And he came to some of the local service agencies. In the beginning, there was only 4, and he asked their executive directors to help him do this. And what he did is he pulled community members, people who lived in the community together, and he locked them up in a gym for about 72 hours. They put out cots, and they were all there. And they ran a process of facilitation that we actually still use today, which we like to call the Blue Board. And they ran this Blue Board process, and they came out with a plan of action that involved creating a collaborative. From there, there was changes in funding cycles, and the collaborative saw its opportunity to get its first sort of stream of funding and hire its first staff person. So this all happened in the 80s. In the 90s, we became much more broader. We changed our name. Before, it was primarily youth-focused, so we used to be Mid-City for Youth. In the 90s, we became Mid-City Community Advocacy Network and really started to focus more on community organizing and broadening our scope of attention in the neighborhoods. But it really changed because it really began with residents and a couple organizations. Then it became very organizationally heavy. And then in the late 90s to now, what we're seeing is a shift towards coming back to the neighborhoods and building partnerships with the people who live there.
Great. So, Ramla, why don't you start talking about how you first became involved and then how it evolved into your current role?
Okay. At the time, I was a student at San Diego State, and I was actually a nutrition counselor. So I was working with the American Red Cross WIC program as a nutrition counselor, and I was seeing a lot of our City Heights residents at the center or the clinic or WIC center because it was located close to City Heights. So at that point, growing up in City Heights, seeing the same families that I have been neighbors with for a very long time, really, I started to get more involved in youth education and youth work. So that's kind of how my advocacy kind of started. It's really with youth. And Then I got connected to the school attendance momentum team through my mother, who was actually participating in the Building Healthy Communities planning process with Mid-City CAN. And she was actually one of the leaders in a group called City Heights Hope. So when she introduced me to Mid-City CAN, I thought it was really appropriate to get involved in the school attendance momentum team, because that momentum team really dealt with youth education and youth work. So after a few months of attending the momentum team, I was elected as co-chair, and after a year of being a co-chair, then I was brought on by Diana as a community organizer full-time with Mid-City CAN. So it's a very exciting transition, because throughout the whole time I was kind of discovering what were my passions, what was I really excited about, and it went from nutrition counseling to advocacy for youth to more advocating for the entire community, because it's a whole family that really needs to get more involved and speak up in order to change what's going on in our neighborhood. So, yeah.
Great, and I love the language that you all use. So again, your acronym is the Mid-City Community Action Network, which is Mid-City CAN. And then can you talk about why you describe it as momentum teams rather than work groups or committees or task forces or something else?
So the concept of a momentum team is very similar to the concept of a work group. But the idea is that when an issue percolates enough energy and momentum, you create a team. And so the idea is that we're always listening to what's happening in the neighborhood. And every now and then we do something called a community scan, which is a listening process that we do at our general meeting. And what you see over time is issues of importance start to percolate up. And when there's enough interest by the membership, we form a momentum team. And the momentum team's goal is really to take action, to be action-centered, to do something about that issue, to make the change that's needed. And once momentum dies down, or the team achieves its goal, or there's different reasons, but basically once momentum dies down, then the team disbands. So what you see over time is you see the birth of new momentum teams, and we say goodbye to a lot of momentum teams as well.
So can you describe what the momentum teams that you have now are focusing on?
The majority of our momentum teams right now are Building Healthy Communities partner teams. And Building Healthy Communities is the California Endowment Foundation's statewide place-based initiative. So a lot of our momentum teams right now are focusing on issues that are in direct alignment with the initiative's outcomes. So for example, Fernanda's momentum team, Fernanda lives in City Heights, but she's also a momentum team co-chair. They have had some success working on food justice issues. So the name of her team is Food Justice Momentum Team. They've worked farmers markets, food stamps access issues, community garden ordinances, and how that relates to the California Endowment's outcomes is that food is a huge component of tackling childhood obesity, which is one of the California Endowment's outcomes. So all of our momentum team, not all of them, but a good chunk of them right now are really focused on issues that are related to the initiative's outcomes.
Great. So Fernanda, do you want to talk more about the food justice momentum team and how you got involved?
Definitely. Like Diana was saying, the Mid-City collaboration created, or it was the birth of the Food Justice Momentum Team. That was the first team to be active in City Heights about maybe 4 years ago, when we saw in our community we have a lot of underserved residents and the childhood obesity epidemic, and we got together a bunch of organizations, invited residents. And I was one of those residents who started coming to the meetings and seeing the needs of the community. Together we decided with the focus groups and different Blue Board activities and different things that resulted in the birth of the City Heights Farmers Market. and the first market in San Diego to accept food stamps, the first market in San Diego to do a top-up program so that the residents will have extra money each month so that they can access fresh foods. And so the Food Justice Momentum Team gave birth to that market in all the extension, permits, everything, all the logistics. And then the Momentum Team achieved their goal and became the steering committee for the market, in which the market is community-owned, and organizations invest time and resources, and then residents come and join and help out, tackle down obesity-related issues. After a while, when the Building Healthy Communities initiative came, and we were doing work with the community, 25 leaders. I became one of those leaders, doing house meetings with residents in City Heights, very grassroots, very basic facilitation of meetings to receive feedback from residents. And then the Momentum Team got, again, a lot of energy, and we started working on other issues pertaining to food justice, and some of this feedback we had received from the residents. We created a logic model to start working on the different things, and right now that's what the Momentum Team is doing.
Great. And then Ito, talk about how you are involved in the Momentum Team that you're working on now.
Well, currently I am the co-chair for the School Attendance Momentum Team, and we work on issues based around school and ensuring that kids are attending school and that attendance is never an issue to education. How I got involved was I am part of another organization, City Heights, called Youth Empowerment Focus, which is under Building Healthy Communities initiatives, and we work on the outcomes around education and attendance. And I would attend all of the Momentum Teams, and I found my main interest being school attendance. From there, I would attend meetings, and the topics of attendance and the family dynamics and the community dynamics around education interested me. And I signed myself up to vote and get nominated into a co-chair. And from there, I became the School Attendance Momentum co-chair.
I really want to highlight what Ito's team is working on when it comes to school attendance, and how that relates to health is her team, and thanks to Ito's leadership, is they're leading a small campaign to get all the children in a specific neighborhood of City Heights to comply with the new whooping cough vaccine requirement. So what is happening in her campaign is they're seeking 100% compliance, and if kids don't get this shot, then they won't be able to go to school, which means that they won't be in attendance. And it's an access issue, because where the shot is being provided by our public health department is not accessible to the students and families of the neighborhood that Ito is focused on. And so many parents are signing the personal belief waiver, not because of their personal belief, but because of lack of access.
So one of the successes of the work that you do, I think, is really striking this balance between resident engagement and organizational engagement that a lot of you have talked very fluidly about, being residents and becoming involved as residents, but also working in a job in which you're bringing your organization along. Can you talk more, all of you talk about that continuum, that fluidity?
Sure. I think what's been interesting about Mid-City CAN is, as I explained the history, is that residents were always involved to some degree within the collaborative. But what you see over time is flux. So you see periods with high resident involvement, and then periods where there's very low resident involvement. And it's all very messy, because it can almost be a culture clash in some ways, because people in the neighborhoods would like to see, I believe, stronger, more direct, faster action, and organizations often want to look at data. We got to do a survey, we got to look at the data, and we've got to build logic models. It's fun work when it happens. There's great outcomes, but it's all kind of messy You know, for example, all the data that organizations want to collect, well, residents have been surveyed over and over and don't want to be surveyed again. And the reality is that organizations, we already have a lot of data, we just forget about it. So it's extremely fascinating work that can lead to very beautiful things happening, like the work that Fernanda's describing, actually.
And if I may add, the advantages of a resident agency partnerships really stem from clear understanding. So residents have identified, or residents and organizations have identified areas of strengths, so where are we strong, points of conflict, and then to the degrees of alignment. So each issue, because again, we have issue-based momentum teams, so this really allows people kind of to self-select and identify where they want to be involved in the most and in what capacity they want to stay involved in. What that does is it really creates a collaborative environment and really helps people to follow through on their commitments because of that self-selecting and because they're identifying which momentum team or which issue that they're most interested in. So that helps as well.
I would like to add that the Building Healthy Communities initiative is really stressing resident-driven, and that we are trying to make it more regular and more continuous, the resident engagement, and all of us as neighbors to be interested. And that is when the collaboration has become more interesting and actually has helped keep the residents engaged, because we are listening, they're listening to our voices. And here is the organization, and here is, I'm giving you my feedback. And our organization is, in the beginning, they were trying hard to tell them, no, this is what you need, and the residents will say, no, this is what we want, no, this is what you need. And so it was like a little bit of a power dynamic, and slowly, with lots of facilitation and resources being invested, trying to change the dynamic, we've been seeing this mutual feedback, and the residents become more engaged into the programs and projects of the organizations, because they feel like, okay, I had a say on this, so I'm going to support it, and I'm going to be there more regularly, more often. And also but we have had, it's not only is messy, but it's time consuming, it's longer. And in the times we've been working together, we have come out to realize it's a systematic issue. We're not going to be project based. We need to make changes from the bottom, and that entitles a lot of education from both sides. Residents need to learn how the system works so we can have our voices plugged in, and then organizations need to be patient in helping the residents do that.
They really summed it up, but the terms they're using describes it. It's interesting, it's fascinating, it's beautiful, it's this dynamic where you have residents who live this every day, who truly know what it is that they need, and then you have organizations who have the knowledge and the skills and the resources to make this happen. And so the both of them put together in this collaboration, it really is an amazing outcome. Work gets done. It is a long process and it's very hard, but it truly gets the work done from a systems level to ensure that this isn't a reoccurring issue and that we have to come back 2-3 years later, redo this.
So one of the things that you've then created as part of your organizational structure is that the momentum teams are actually co-led by someone from a community-based organization or a department of state government or local government, rather, and then a resident. So how has that worked in terms of sharing explicitly that kind of leadership?
So as Ignatius mentioned, it's a co-leadership, and we like to say it's residents and their allies. And it's worked out pretty well. It's worked out pretty well. I think that having that shared leadership really sends a message to the members of momentum teams and the larger collaborative that this is something that we need to do together, and that we're going to share power, and we're going to share leadership, and that we're equal. versus just having an organizational leader who could be perceived as representing only organizational stakeholders, or versus having just a resident leader who could also be perceived as just representing a resident neighborhood level stakeholder group. So I think it's been pretty good.
So Ramla, sort of moving from being a resident lead of a momentum team to now being staff, how has that changed, or how has that been for you?
It's been quite an interesting ride. I mean, again, I was going to school at the time. I was a nutrition counselor, so moving from a agency point of view, you know, from basically, you know, the family and the communities is where the problem lies, and that's where we need to fix issues, to progressively from my youth involvement to now being a staff person with Mid-City CAN. It's now shifted quite drastically. Now it's how do we change systems so that resources are allocated differently and in more equitable ways. So that's kind of how my thought processes have kind of changed along the way. And again, speaking to what Diana was talking about, the two co-chairs, I felt from my experience, there was a strike of balance there, because the residents would hold the agency person accountable, and the agency person would then kind of also reel in the resident partner if they're just kind of, you know, they're pie in the sky thinking, right? So they kind of really help to balance each other out. Sometimes there are conflicts, you know, and it's inherent in the system because you've got two opposing theories coming together, so there's a natural clash there. So the processes really help to kind of control that. Again, we identify points of conflict and where there are degrees of alignment, and kind of it's a collaboration. So you're constantly negotiating. You're expected really to come halfway and sometimes even a little further than you can stretch. Fernanda, I think, can speak to this a little bit more, because at Food Justice Momentum Team, some agencies would say, well, I can't lobby or I can't do advocacy work because of my role. And so they've kind of found a really interesting way to kind of help navigate those barriers as well.
Yeah, I wanna speak about this conflict resolution when it comes to the collaboration between organizations and residents, and different type of organizations and agencies even, and the residents. It's become hard at times to share a vision and to share a desired outcome. So we've invested lots of time and resources on trying to solve that, and we've learned and have started to practice consensus decision making, so that we will have the agencies, the organizations, and the residents trying to all negotiate on an outcome and a desired result of whatever we're working on. And indeed, the Food Justice Momentum Team is very diverse. We have lots of agency, organization, people sitting at the table who are being at their staff, and they're being paid for that, and we are trying to engage the residents who are in their own time. They need to come and talk, and they need to show up at the council and speak about policy change and municipal code change. And so we have to do lots of different activities and share and be creative about it, how we do that with the residents, with the youth who are attending school, and we're not going to affect that, and how they can help us in creating this interest from other residents. And so it's become quite interesting. At sometimes I really just wanted to leave and say, forget it, you know, this is never going to happen. But I come back, and you know, we have learned a lot. Diana and I have learned a lot together about conflict resolution. Maybe we don't see eye to eye at times, and then we sit again, and we're stubborn, and we keep going and say, okay, Diana, I really want to keep on going with this. What are the resources? How can we resolve this? And we have had times in where we totally don't agree, and then we sit down again and we start talking, and we don't sleep 72 hours at this, you know, we don't stay there any longer, because I think we've learned through the years how to resolve things in a more efficient way, and then transfer that to my neighbors, because I'm in I am the neighbor who's sitting at the table with the agencies talking about these things that we care about out there. So same dynamic with my neighbors, and I come to the neighbors, I say this is what is happening, and they yell at me, no, we didn't want this, and I explain to them, and so it's become successful in that way. We've learned how to communicate with each other, agency, organization, lingo versus resident. Vocabulary is very different, and so we've learned together, and the conflict resolution is what is, I think, for us, has become the biggest thing. I always think when we have a big crisis, we can have a big positive outcome if we know how to handle that, and we've learned together how to navigate.
So I want to come back. There are a lot of great issues raised, but I think, again, this is something that a lot of collaborations really want to do more of, which is that kind of authentic resident engagement. What have you done more formally to sort of support residents? Clearly, you mentioned you have to take care, pay attention to the fact that they have different time constraints, that they're volunteering their time, that they may have jobs or school commitments that you have to account for in terms of scheduling. What else have you done to make it easier or to support residents to be more equal partners in the work that you're doing?
Well, my first thing is you have to be deliberate and intentional about it. You have to want to do it, and you have to see value in doing it. I think that organizations, when it comes to collaboration, an organization can just very easily call a meeting and look in their Rolodex and say, okay, everybody come. And what has kind of happened, I think, over time is that organizations have become providers of services. And residents, we've forgotten that they're actually really important partners. And so we think of them as clients. I'm giving you this service, you're my client, and we forget to invite them to the table. When in fact, residents and people who live in neighborhoods can be the biggest partners and can add a lot of value to the work of organizations. So you've got to see that value, and you've got to be intentional about doing it. We've touched on a few things. Part of it is the technical aspects of it, which is what time are we meeting? Is there childcare? Are we providing snacks? Because people work all day and they get off work, and those technical pieces. But beyond the technical pieces are really the leadership pieces, which is being really deliberate about building resident capacity and leadership and supporting that, and being really, really clear with the people in the neighborhoods that you're working with about what you're asking them to get involved in and why. And also, because of the power dynamics, who gets to make what decision? How will those decisions be made? And what promise are you making to people in the neighborhood? Because if you invite people to the table and you promise them the world, and they ask for the world, and you can't give the world, then you've unintentionally misled people to believe in something that you really couldn't deliver. And that's what creates conflict, is when you don't support the leadership development, the capacity building, the knowledge building, and when you're unclear about why people in the neighborhood should come to the table with you.
And our role as co-chairs, I feel, is we have to look at the big problem and cut the issue and find out what it is, what it is that we're really facing here, because like Diana said, we can't promise the world to the residents. We have to be reasonable about it. We have, is it winnable, is it attainable? And we have to best educate the residents on how we can get there in the best way. I mean, there's a lot of language barriers, so translation is very important in our community. So the residents, once you educate it to them, and you educate them about it, and you put it on the table to them, they want to fight for it. They will be, most of the time, they will be leading it and running it, and we support them, and the organization support them in whatever way it is to get that issue done.
Great. So then on the other side, and so maybe Fernanda and Ido can talk about this from working at an agency or an organization, have you seen changes either at your organization or at other organizations as they begin to work more in this partnership, in this more co-equal relationship with the residents? How have sort of your bosses and the people in the organizations changed?
Yes. And this is something I wanted to add to what Diana was saying about the resources for the residents. It's also been the education of the organization and agency staff. Originally, I wasn't a staff member in any organization. I was just a resident. And we were always bringing back the issue of when you are interpreting in a meeting, the meeting is not going to go as fast. And you need to stop because the interpretation is not only the language, it's also the culture. And why is this person speaking like this to us? And what is the actual intention of that? And so we've had to explain numerous times, and the organizations showed some resistance because they want to be efficient and productive. But after a while, they realized, well, there's no way we can be, having this 2-hour meeting with interpretation and have so many items in the agenda. So that has become also like a resource given to the residents, the education of the organization staff members. And then coming from when I became a staff member at the International Rescue Committee for the farmers market, and I'm the co-chair for the Food Justice Momentum team, at times I felt pushed to wear one hat or the other. And that was conflicting, and that was annoying and disturbing for me as a neighbor to be having to wear 2 hats. So it took me a while to grab some strength and come and talk to the executive director of my organization and say, this is what's going on, and I don't, I'm gonna have to choose soon, either or, because I feel like we're not aligning our vision to what City Heights, or I don't wanna just be refugee-oriented. It's a community and things that we had to talk about. There were conversations, there were lots of conversations with other people in my department, and one day he came to me and said, just wear 1 hat. You're a resident, and that's why you're here. You're a resident, and you're working, leading this and doing this at the farmers market and doing all this advocacy because we like the way you think, and we wanna improve City Heights. So I'm just wearing a hat.
That's great.
And, so there's amazing transformations happening over City Heights where it's not more, the residents aren't looked at as clients and, oh, we need to help them, oh, we need to run to them every time there's an issue. The residents are being given the opportunity to make real changes. They're working in these organizations. They're all over the community as community organizers, caseworkers, translators. So it's this community that's driven by residents that are working in their community to make the change. So it's different. And I've seen it living in the community over 15 years, the difference in the past 5-10 years since we've been on this move to make real change in the community.
If it's okay, I want to go back to something that Fernanda said, because she was making a very important point, that it's not just about the capacity building and the education for the residents, but it's also the capacity building and the education for the organizations. And that's just as important. So it's also about teaching organizations and supporting them to develop the kind of collaborative leadership that they need to work in partnership with people at the neighborhood level. And I think that that's equally as important as building and supporting the leadership and capacity of the residents who are becoming involved.
Great. So another thing that you all have done that has been, I think, again, what a lot of people aspire or want to do is really engage youth. And there's another whole set of issues about power, about understanding. So can you talk, Ramla and Ido, about how you've been able to engage youth and as adults, again, how we relate to youth and how we might have to learn different things about authentic engagement of youth?
I think Diana and Fernanda both hit the nail on this one. It's about educating the agencies as much as it is educating residents and youth. So in the beginning of the whole process, Mid-City Canada's kind of help to prepare agencies and other organizations participating by doing a series of workshops from that make them a little bit more culturally sensitive or aware. And one of those in particular was about adultism. So making sure that when we have young people in the room that we're not just having them as tokens or as prizes to sit there so we can be proud and say, we've got youth, but rather that they're equal partners, they've got as much say as everyone else, and we really need to start listening. And by listening, really taking what they're saying, putting it up in front of everyone, and making sure it's part of the plan. So that's been the challenge in the beginning is youth would come in, they're a little shy, you know, they're 13, 14, 16, they've got these professional experts in the room, so they just kind of quietly sit back. And you know, it's understandable. So it's been a real challenge in the beginning, but those workshops really help agencies to kind of tone it down a little bit and let youth in particular step up and take leadership.
So we keep in mind that youth can present solutions and not only the problems, and that they should be at the table when these decisions are being made, but also they have to trust you, they have to know that they know it. An organization comes into the room, we want youth to sit around, oh, we brought youth. They know, and then leave and not really do anything for them. So it's about creating that trust with the youth and educating them and giving them a real task or something to do, because they won't show up next meeting, guarantee you. But if you give them something to do and then you show them that, hey, you have a responsibility and yes, you can make true change, they'll come. And you know, our youth throw around that word all the time, hey, that's adultism, when we say something and we forget to include them, and so we have to, hey, remember, tone it down.
And if I could just add an example, not too long ago at one of our peace promotion momentum teams, I had a young man, or young boy, he's 17 years old, he went to Hoover. He came up to me and he said, you know, coming to these meetings and sometimes even working with these agencies, I feel like I'm a commodity. They just want to sign my name so they can, you know, check it off some list or something. So even they understand, and that kind of turns youth off, and they say, you know, frankly, I don't want to be just another name on some organization's form so they can say they've served me. So that's kind of been a real challenge too. It's getting the trust back from youth and saying that, you know, we understand the experiences in the community. Diana talked about the over-surveying of our residents. They've been very clear, no more surveys, no more asking us what we want. You have plenty of information. And for youth, it's been, I don't want to be just some list. So what we've developed is, with Youth Empowerment Focus, really, and with our Youth Council at Mid-City CAN, those two groups have become like models for youth engagement, because what they do is they take true ownership in the programs. They make decisions on what it is they want to take action on. They're very clear on why they want to take action, and the staff people, the staff support that are there to help them, really help facilitate the process and help them understand what they need to understand, and plugging them into the resources they need. So that's been a real shift as far as how agency people are helping to work with residents and really helping youth to kind of take control of their lives and their community.
And become more empowered.
So I'm about to come and get questions and comments from all of you, but my last set of questions is, you've talked a lot, and I think we've gotten a really good sense of how the work gets done through the momentum teams, through the partnerships. There's training, there's workshops, there's orientation, there's support. Talk a little bit about big picture. We've seen some of the videos where you've had these amazing sort of town hall community meetings of hundreds of people. And again, that's something that a lot of us who work in collaborations also aspire to. That's a lot of work to get that kind of level of coordination and engagement and involvement. So talk about how you sort of do the big picture.
Wow, that's a big question. We're very fortunate in City Heights if Mid-City CAN calls a meeting and we put it out there, hundreds of people will come. So we're very fortunate. I think it's the right sort of problem to have, but it really begs a lot of questions around logistics. because coordinating very big picture events can be a whole feat in itself, a whole area of expertise. And when it comes to big picture, not just the coordination of big events, but ensuring that they're really purposeful and meaningful is really important. And they challenge as well. And above and beyond just the big picture, really the question is, how do you really cultivate a comprehensive shared vision when you're working with hundreds of partners and stakeholders? How do you really cultivate a shared vision in a community of 90,000 people that speak 80 different languages? And in our big events and the work that is done in the momentum teams, how do you cultivate common goals and common shared plans of action? And how do you create clarity so that everybody knows what they're bringing to the table and what their part of the process is? And there's no magic formula for that. Structure, clarity of roles, participatory decision-making processes, like a consensus model, which is what we use, can all help do that. But in the end, those questions are the big questions, or the hard questions. They're the critical questions because it's what keeps people coming back. And there's no magic answer to those questions. In every collaborative I've worked with, it takes its own flavor and shape and way of coming about. So it's interesting.
So having participated in some of these big meetings, any insights to share?
Before I was a staff person, actually, I was with school attendance, like I mentioned earlier. And one of our biggest events was Community Congress, and we had over 400 people, 300 to 400 people attend that meeting. And school attendance and the rest of the momentum teams, there were basically breakout sessions. So each momentum team would have residents interested in that specific issue come to hear back what has been done in the momentum team throughout the year of planning. And so being there was just kind of seeing how many translators were there. And then at some point, Noelia, which is our lead organizer, she was like, wait a minute, we're running out of translators. So she went and got participants at the Congress, Community Congress, to become translators. So she was going around asking our resident partners kind of, can you fill in, can you help to translate? So that was a really interesting experience, just to show you, how many people participate and then how many languages there are. Technical difficulties occur, and that's, one of them is not enough translators.
So how many languages were you providing interpretation for?
The final tally for that day was 16.
Wow. Wow. So any other experiences to share from the big meetings?
I think they've touched on the logistics, and in City Heights, actually, International Rescue Committee has identified 34 different languages and dialects from the 5 continents. And so that's a big challenge. But I also, like, the big picture for me is that the residents and the neighbors don't just come to a meeting, that they're trusting what you're saying, and gaining and keeping that trust is a slow process, because again, we touch up on the sharing a vision. So for me, to have is very interesting to see the residents come together. We had recently, like 2 months ago, we had a town council meeting for ordinance change, and we rallied 200 people to come, and the 200 people wanted to speak to the council and tell them, this is what we want for community gardens. But gaining that trust, it was a process. And so I think it's very important as a collaboration to keep working on these consensus-making decisions so that the people will keep coming and participating, and we can create a system change, not just a big event.
And from those big meetings, it's a lot of work put into them, but the end result is a lot of momentum gain, and the residents are so excited to see what's next. And so it's always important at the end of those meetings to let them know what's next and how they can participate and be involved, and just to keep that momentum going.
Absolutely. And if I may add, at the town council meeting that you're talking about, we, Jen Chandler is the other co-chair of the Food Justice Momentum team, and I remember Fernanda and Jen sending emails, for those agency folks who may not have a role in advocating because of their professional role, because of the hat that they're wearing in the Momentum team. So one of the asks, and we always have asks in all of our meetings, and sometimes they're difficult to meet, and sometimes you can find ways to kind of navigate that. And one of the ways Food Justice in particular has navigated that is asking people, if you can't support residents on an organizational capacity, then we'd like for you to come as an individual. Could you do that? So them coming to these meetings as individuals to be bodies in the room, cheering on our residents as they speak in front of city council or anyone else they need to speak in front of. So that's one of the, how we navigate problems or how we negotiate when we need the support.
That's great. So let me open up to all of you. That's probably sparked a lot of questions and comments. Ellie has a mic.
And Shauna, and if everyone can use a mic and stand up, that would be great.
Gotta have questions. So please stand up and.
I had a quick question. When you have your collaborative meetings, how do you, with so many languages, how do you coordinate that? And where do you use interpretation equipment, or what are your logistics? And how often do you meet as a kind of a full collaborative?
We have a general meeting that occurs once a month, and it's an open meeting, so anybody can come, and attendance tends to change based on the speaker for that day. So the purpose of that meeting is really networking, and in those meetings, we usually know in advance if there's residents that are coming that are going to speak different languages. So we use simultaneous interpretation. And the thing about City Heights too is that it's also more of an oral community. So in the beginning, lesson learned for us was that we were also translating everything, but people weren't really reading the translated materials because it's really a community where people pass on stories. So we realized that oral communication and the interpretation was really the bigger piece of it. Momentum teams, as Ramla mentioned, they really draw residents and stakeholders who are interested in a particular issue. So we seldom see the entire collaborative in one room, with the exception of very large events. And right now, very large events, like the one that the ladies were speaking about, the Community Congress, they happen about every 2 years. And that's when you really see the full range of diversity, from very high level, not high level, but local city councilmen to our grassroots residents who maybe have only been in the country a couple months. So that's when you really start to see the entire scope of the collaborative. But our regular meetings, monthly meetings, you see different pieces of the collaborative and different groups of stakeholders.
And when are the monthly meetings, and how long do they run?
The monthly meetings are on Tuesday mornings, and they run an hour and a half, and they have they're pretty structured, so there's networking for about half an hour. Then the coordinating council co-chairs, which is our governing body, and they are elected every year, they facilitate that meeting. So there's general announcements that collaborative members make to each other, and then there's usually a guest speaker, and then we all go home.
If I may add too that, like Diana explained, in our community is a word of mouth. So I will, if I know that there's a speaker or something relevant at this meeting, I will invite my neighbors, and then I'll call Mid-City Can and say I need Spanish interpreter or I need Somali interpretation, and they will hire the interpreter and get the equipment to do such. In the event that is spontaneous and we just show up because we weren't sure we were coming, the community comes together and they interpret for each other. And so we have learned to collaborate and learned how to help our neighbors understand what's going on so they can get engaged.
Also, a lot of cultures don't really like the hearing piece. We've found out that I know what the reason is behind it, but a lot of Somali women that we work with them, they don't want to wear a hearing piece, and a lot of other cultures in the community, so it's tending to that certain culture too.
Great. Other comments or questions?
Can we hear a little bit more about the elected governing body?
Oh yeah, so Mid-City CAN has a governing body. They hired me. They're like a board of directors. They're elected every year. We run a election process. You have to be a member to vote, and you have to be a member to run for election. The 15-member governing body is composed, 60% of the seats are reserved for residents of City Heights, and you have to have lived in City Heights for at least 2 years. And 40% are composed of non-resident allies, and you have to have worked, studied, volunteered in City Heights also for at least 2 years. And every year, it's about a 6-month election process. We announce elections. There's criteria, some of which I have mentioned. The coordinating council will convene an election committee that then vets the slate to make sure that the candidates meet the minimum criteria. Then we send it out to the membership, and then we hold an election day where people come and vote. We average about, the last couple of years, we've averaged between 75 and 100 voters per election. We average around 20 candidates. We put 5 seats up every year, and people serve 3-year terms. There's term limits, so you can only do 2 consecutive terms, then you have to sit out a year before you can be reelected. But their primary responsibility is policy making, fundraising, ambassadorial. They also run a grievance committee, so if we have a conflict that escalates and is not being negotiated out through the normal processes, we can convene a grievance committee, and they have final say on whether a member could be asked to leave or whether there would be changes resulting as the grievance, out of the grievance. So they're kind of the big picture people in the whole thing.
Great. So there was a question here, and then we'll come back up.
Good morning. Could you please describe a little bit more the consensus decision-making model with such a large collaborative and some of the challenges you've had with that?
Yeah. So we have a formal process of consensus that was actually designed by our young people that the coordinating council recently adopted that involves using gradients of agreement or numbers. So we ask people to put up their hands, whether they agree or they're trying to block a proposal. You can do that for 3 rounds. And if a proposal keeps getting blocked after 3 rounds, but there's a strong supermajority, you can default to a standard vote. What often happens, for example, in the coordinating council is it takes place more conversationally. So instead of actually putting their numbers up, the coordinating council likes to do this. They sparkle. But if they're making a decision that is very weighty for them or controversial, then they'll be very deliberate about using their numbers because it allows them to express individually where they sit on the issue, and that gets recorded in the minutes. We also use a couple tools, consensus tools. So Fernanda and I talked about using actually we've all talked about using the blue board. We call it the blue board. It's a giant sticky wall that allows people to first individually record their thoughts and ideas, then share with each other, then together they select which thoughts and ideas they want to elevate forward, and those go on this board, and then the team moves them around. And that is a facilitated process. So that's when staff is most engaged in helping teams make decisions. Because when we wear our facilitator hat in a team, we don't participate. staff doesn't vote. And actually, we never vote. So it's our job as facilitators to not vote, not sway, and try to help the team come to consensus, as opposed to inserting our own personal ideas. We don't always agree with what the team decides, but it's not our job to decide for the community what they want to do. So we use the Blue Board process. It's a great tool, especially if you have to do planning. We also have another tool if you're doing planning, and we also put it up on the Blue Board called a decision matrix, which helps people vote on issues, and also people generate cards, and we move them around, and it helps the team narrow things down. So
great.
If I can add, our youth council actually added an amendment to that. So they go through the same process, but if anyone blocks a decision, they have to put it in writing, and then they have to explain to the rest of the youth council so that they know that, you know, it makes sense, or the reason why someone's blocking it makes sense. So that's just an additional step that they've decided to adopt.
Our youth are very wise.
Yes.
And hopefully throughout the rest of the 2 days, folks will be sharing their other techniques as well.
And Ignatius, I just want to add that Sam Kainer, who's our keynote this afternoon, will be explaining gradients of agreement in case that's something you're not familiar with.
So can we get a mic up here, and then we'll go back there.
Hi, I was wondering, you were talking about the neighbors aren't interested in doing data anymore, and the organizations probably really are. I know mine is really interested in outcomes. How does that work out, or how do you keep the organizations wanting to come if they're not getting the data they might need for outcomes from the residents?
At this juncture, we've taken a pretty strong stance that there will be no data collected at Mid-City CAN, and we're just not going to do it. So why do organizations still come if they're seeking data? I don't know. But that doesn't prevent organizations from going back to their office and doing their own data collection. But Mid-City CAN's about action and about bringing people together. We're not here to be studied, and we're not here to collect data, and that's it.
And to add to what Diana said, I mean, even though there's not data being collected, when organizations come, they build relationships with the residents, and there's this connection where they have, you know, meaningful conversations about what it is that they feel needs to change. And I see a lot of organizations going back to their offices and then making changes, like, okay, maybe we should do it this way because of what the residents have told us.
And there's other sources. So the immunization that you're working on, clearly the schools are recording whether or not you are getting to the immunization levels that you're trying to reach. Right. So it's not that Mid-City CAN is collecting the information, but the schools are.
Right. And I just want to say that the question that you're asking really kind of goes back to the conflicting theories, right? Organizations or agencies are coming in with a service-oriented lens. They're coming in saying, we're going to bring you resources and we're the experts. Whereas residents are really saying, we need to see systems change, and we want to do that through participation and capacity building activities and advocacy. So those are the two opposing sides. And we, you know, if the residents have a pretty strong stance against something, Mid-City CAN is going to support that, because that's what it's about. It's about residents and organizations coming together for one thing, and that is to change the, you know, changing inequalities. You know, what are the inequities in our community, and how do we change those conditions? And sometimes you need data, and sometimes you don't, but we found that majority of the time you don't, you know. And agencies want data because of their specific agency outcomes. And again, that's when we have to remind people, this is a collaborative. It's not about you as an individual or you as an organization. It's a collaboration. So when you come in, you have to expect that we're not going to meet your needs, you know. And sometimes what happens is we align. So what you're looking for in this momentum team and what the momentum team is looking to do sometimes align, and that's where there's a really good match. And sometimes it doesn't. What you have to do is really kind of sit through and support that initiative or effort.
So lots of other questions. Let's go back here and then come back.
Is Mid-City CAN, are you incorporated?
No.
So how does money flow to support you?
We have a fiscal agent. We're not a 501c3, and we have an agreement with our fiscal agent to basically channel our money, and when we apply for something, we use our fiscal agent's 501c3, our fiscal agent's audits. One of the things they do to support us is provide the back of house, the bookkeeping, the human resources guidance, the insurance, the risk management aspects of it. And they're really great because our fiscal agent, you rarely see or hear of them. They don't try to tell us what to do. And when they do participate, they participate as a non-resident ally, just like everyone else. So they've been really wonderful.
So let's come to the middle here.
Good morning. I had two questions. The first one is, I've heard systems change. Residents want to see systems change. I really would like to have you articulate, how does residents see systems? I mean, when you say that, is it public health system? Is it social service system? Is it the school system? First question. Second question is, as we engage with residents in communities of color in urban America, I find it very challenging to engage with residents and find the men of our community to engage in these processes. If you found that as a barrier, please give me some advice. And if not, I'd like to hear how you've done it.
Great questions.
Sure, I'll answer it. Your first question was about systems change and what that means to our residents. Well, it depends on the issue. So for school attendance, it's the TDAP campaign that they're currently working on. They're pretty mad at having a mandate without really the access points. So one thing that they're doing now is first trying to help people meet those mandates. 100% compliance may mean, like Diana mentioned earlier, signing the waiver even when they don't want to, just so that our schools don't lose out on money because kids are not in attendance. So that's the first issue that they have to solve. And the bigger issue cut, and if you'd like, either can talk to you more in depth about it, is really engaging those parents and the youth really to advocate and challenge the county or our local health and human services department in saying, look, you know, you've kind of made this mandate without really thinking it through. Now here's what we want to see, and that's something that they're currently working on is what do we need them to do? What kind of assessment do they need to complete before they can mandate something on our community so that they're not creating these inequalities, right? So that's kind of the first answer to your question, how do our residents see systems change? The second question, with the men of color not being as participant ready as the rest of the community, well, we've kind of found that it's pretty much the same and not the same in our community. We have a pretty good, strong participation, but that in some teams and then in others, we don't have that strong participation. And that's really where we identify, you know, where are the degrees of alignment, where are the points of conflict, and really going back and understanding the self-interests of people. That's what we use a lot is, you know, what are you passionate about? What are you really motivated and why? What is your experience in this community, and how can we help you tap into that in some of the momentum teams? So connecting the person's self-interest or their personal ambitions to those ambitions of the team, that's really where we find good connections. Other tactics I've used as an organizer, really, and my first and foremost role is to organize. So I have to go into the community, talk to our Somali men, and have a coffee with them, because that's what they like to do. In our culture, we're big coffee and tea drinkers, and we're usually at third places like Starbucks. We're usually at the local restaurant. So it's about tapping into those places, going in and saying, hey, you know, why are you absent? Like, let me understand. And that connection is there because I really understand their culture, because it's my culture. And the Somali culture is much different and then much the same as in other cultures, but one thing that's unique about the Somali culture is that everyone's uncle and everyone's aunt, right? So I see Diana walking down the street, hi auntie. So that's kind of our culture. So it's very, very tight-knit, and it's very family-oriented. So I tap into that a lot as well, and I sit down with them. Hi, Uncle, how are you? How's your day? You know, we were working on this one campaign I thought you'd be interested in, but I didn't see you there. What happened? So it's really about having conversations, talking to people, really finding out what their self-interest is, and then connecting them to that. And Fernanda described how she involves her residents or her neighbors as well. So.
And if I may add to this, again, it comes back to re-educating ourselves as agencies and organizations, because City Heights is very unique because we are very diverse, and the original leaders, they represented the whole spectrum of the community. They were Burmese, Somali Bantu, Latinos, Southeast Asian, from all the spectrum, 25 different people who were going to engage people like them. So I think re-educating ourselves in how we think, not only, you know, like come out of the box. We've had meetings at the farmers market. We have a special area in which you can come and meet with people on a Saturday. We have activities for children. We have interpretation. We serve food in all of our meetings, so that if you're a parent, we just pick up your children and you're interested in coming to this meeting, you don't have to cook dinner or worry about that. Come here, have dinner with us. The children will have activities and things like that. But mainly it's a very organic process. You've got to be always thinking about what is the need of the community, what they want, try to identify that, and look for people who are alike the target audience you're looking to engage. And that's what's been the Mid-City CAN role with all of these, 25 different people in the beginning.
Right, and Fernanda is really describing creating a safe space, right? You want residents to come in and feel comfortable at home in your momentum teams or work groups or issue-based work groups, whatever you want to call it. You want residents to feel at home, and that's kind of been why we've been so big on the technical pieces, you know, dinner, transportation, not transportation, but translation or interpretation, childcare, all of those pieces.
So I know there's lots more questions and comments, and they're actually going to be one of the breakout sessions, so you can also follow up. But I want to end the session on time with one final question for our panel, which is, the work that you described sounds amazing. What's sort of your hope for the future for your community?
Wow. You know, I'd like to see a City Heights that stands up for itself. For example, we have 5 freeways, and they're talking about expanding them again. And so we have some of the highest rates of asthma. But to have a City Heights, to have a significant number of the 90,000 people that live in City Heights stand up and say, don't expand our freeways, we need buses to get to work because we have the highest bus ridership, would be amazing.
For me, it's, I mentioned earlier, the Somali community is very tight-knit. So I'd like to see City Heights as a really tight-knit community and a family through all of this participation in the momentum teams, in their own resident advocacy or capacity building activities. I'd really like to see the outcome of that to be residents that are very much family, standing up together like Diana mentioned, and advocating for their rights.
Yeah. Possibly something like that too, that more residents will be knowledgeable about what you need to do if you are against something. To be more specific in the longer term, as a resident of City Heights, I want to avoid gentrification, and I want to make sure that we all, after we are making all these changes, we can still stay there.
For me, it's a community that makes true systems change on their own, advocates for themselves, and also youth to lead that initiative, to be the people who are really making those decisions and changes.
So please join me in thanking Ido, Fernanda, Ramla, and Diana for a great start. Thank you all.
I hope